Welcome to our channel, where we delve into the fascinating world of health and wellness. Today, we're exploring an important topic that affects millions of people worldwide: the difference between type 1 and type 2 diabetes. Understanding these two types of diabetes is crucial, not just for those living with the conditions, but for everyone who seeks to gain a deeper insight into how our bodies function. Let's embark on this informative journey together. Diabetes, in its simplest terms, is a chronic condition that affects how the body processes blood sugar, also known as glucose. Glucose is a vital source of energy for our cells. The hormone insulin, produced by the pancreas, plays a key role in regulating blood sugar levels. However, when this system malfunctions, diabetes can occur. But what exactly distinguishes type 1 diabetes from type 2? Let's explore each type in more detail. Beginning with type 1 diabetes, we find that it is often diagnosed in children and young adults, which is why it used to be referred to as juvenile diabetes. Type 1 is an autoimmune condition. This means that the body's immune system mistakenly attacks the insulin-producing cells in the pancreas, known as beta cells. As a result, the pancreas produces little to no insulin. Without insulin, cells cannot absorb glucose, leading to high blood sugar levels. The precise cause of this autoimmune response is not fully understood, but it's believed to involve genetic factors and possibly environmental triggers such as viruses. Type 2 diabetes, on the other hand, usually develops in adults, particularly those over the age of 45. Though increasingly, it is being diagnosed in younger people, including children and adolescents, often due to lifestyle factors. Unlike type 1, type 2 diabetes is primarily characterized by insulin resistance. This means that the body's cells do not respond effectively to insulin, even though the pancreas still produces it. Initially, the pancreas compensates by producing more insulin, but over time, it may not be able to sustain this increased production, leading to elevated blood sugar levels. Several factors contribute to the development of type 2 diabetes. These include being overweight, having a sedentary lifestyle, poor diet, and genetic factors. It's important to note that unlike type 1 diabetes, which is not preventable, type 2 diabetes risk can often be reduced by maintaining a healthy lifestyle, which includes regular physical activity and a balanced diet. Now that we understand the fundamental differences in the origins and mechanisms of type 1 and type 2 diabetes, let's talk about their symptoms and management. Both types of diabetes share some common symptoms: excessive thirst, frequent urination, extreme fatigue, and unintended weight loss. However, these symptoms can manifest more suddenly in type 1 diabetes, whereas in type 2, they may develop gradually and can sometimes go unnoticed for years. Management of these conditions varies as well. For type 1 diabetes, insulin therapy is essential. People with type 1 must administer insulin through injections or an insulin pump to manage their blood sugar levels. They also need to monitor their blood glucose regularly and maintain a careful balance of diet and exercise. In contrast, type 2 diabetes management might begin with lifestyle changes such as improved diet and increased physical activity. If these measures are insufficient, medication may be prescribed to manage blood sugar levels. In some cases, insulin therapy may also become necessary if the disease progresses. While treatments and symptoms provide distinct avenues for distinguishing between these types, the complications arising from poorly managed diabetes are alarmingly similar. Both types can lead to serious health issues, including cardiovascular disease, nerve damage, and kidney failure, underscoring the importance of proper management and monitoring of blood glucose levels. In conclusion, although type 1 and type 2 diabetes have distinct causes, mechanisms, and management strategies, both require diligent attention and care. Whether you're dealing with diabetes yourself or seeking to understand it better for the benefit of those around you, knowledge is power. Understanding these differences can aid in recognizing the conditions early, promoting better health outcomes. Thank you for watching this informative video. We hope it shed light on the differences between type 1 and type 2 diabetes and, as always, empowered you with knowledge. If you found this video helpful, please subscribe to our channel. Your support helps us continue bringing you more insightful content. Until next time, take care and stay informed.